2023, WHO, the World Health Organization, said that the 1 in 6 bacterial infection is now resistant towards the standard treatment. India is especially affected. That's why the World Bank warned India that India's GDP will reduce by 5 to 6% in 2050 due to antimicrobial resistance. Today we are going to learn about what is antibiotic resistance, what it is, how it is emerged, and what we are doing about it in India. Let's move on to the topic. Before entering into the actual topic, we should know what is antibiotics. In simple words, we can say antibiotics are the medicines which used to treat bacterial infection, which will destroy the bacteria and then it will prevent the growth of the bacteria. It does not work on virus. The common antibiotic classes are cephalosporins, tetracycline, penicillin, macrolide, and then fluoroquinolones. For example, we can take amoxicillin, a class of penicillin which is used to treat ear infection, and then azithromycin, a kind of macrolide antibiotic which is used to treat respiratory infection, and then ciprofloxacin, which is a kind of fluoroquinolone which is used to treat the urinary tract infection. These are the basic antibiotics used by the common people. The most important thing is antibiotics does not work on viral infections like flu. Now we will move on to antibiotic resistance. Every time we take antibiotic, we are giving chance to bacteria to learn and adapt, which means antibiotic resistance is nothing but the bacteria is evolving and surviving over the medicine which is given to kill them. Over the period of time, the bacteria which survive will multiply and produce a strain which is having resistance towards the antibiotics. So the medicine which is given to kill the bacteria is no longer working, and then the bacteria which is surviving is overcome the effect of the medicine. This is what antibiotic resistance. Do you know the WHO also consider antimicrobial resistance is one of the top global health threats, and then a recent Indian data shows an alarming antibiotic resistance level. According to ICMR report 2025, the Klebsiella pneumonia, it's a common pathogen which causes pneumonia. It's a respiratory infection. So this is showing 70% resistance towards the cases which is treated by the antibiotic piperacillin tazobactam. In ICU, Acinetobacter baumannii, a common in hospital infection, which shows 91% resistance towards the antibiotical meropenem. And then all the 72% of bloodstream infections are caused by a drug-resistant gram-negative bacteria. Finally, the Salmonella typhi, which is a common pathogen cause typhoid, showing more than 95% resistance towards the antibiotic called fluoroquinolones. This report is taken from the India's leading hospital, which means the everyday antibiotics we are using is no longer working on the simple common germs. Now we will move on to the historical trends of antibiotic resistance. The India's consumption of antibiotic is skyrocketed over the past 2 decades. According to 2000 to 2015, the India's consumption of antibiotic is rose by 103%, which means 3.2 to 6.5 billion daily doses. Not in 2025, in 2010 itself, India became the largest consumer of human antibiotics. Because of this increased utilization, there is an increased resistance. For example, the Salmonella typhi, a common pathogen which causes typhoid, is showing 8% resistance in 2008, which is rose to 28% in 2014. A Lancet study also shows that 250,000 people died in India in 2019 due to antimicrobial resistance. Now we will move on to the economical burden of India due to antibiotic resistance. A recent study in India shows that the private hospital bills for antibiotic resistance infection is 10% more than that of normal infection. So the people who are affected with antibiotic resistance had to sell their assets to pay for care. More than half of the family is borrowing money from others. More than 10% of the people who are selling their properties. The experts warn, if the resistance is not curbed, it will lead to slow down the economical growth. That's why in the beginning of the video, I said that the World Bank warns India that India's GDP will reduce by 5 to 7% in 2050 due to lost productivity and higher healthcare cost. I understand what you're thinking after hearing this. How much problem is happening due to this antibiotic resistance? What solution does the Indian government have for this? Let's move on to the Indian drug regulations on antibiotics. India has responded with a National Action Plan on Antimicrobial Resistance, which is launched in 2017 and updated as National Action Plan on Antimicrobial Resistance 2.0 for 2025 to 2029. In 2023, the Union Health Minister outlined the key strategies. They are awareness campaigns, lab capacity building, and then hospital control infection. The government also launched a red label public campaign in which the antibiotic packages are having a red strip and then a label warning says that the people are urged to take this only on the doctor's prescription. Some states like Kerala and Gujarat is completely banned the antibiotic sale without prescription. The Drug and Cosmetic Act 1945 classify all the antibiotics under the Schedule H, which means the sales on registered medical practitioner's prescription. In 2024, a tighter Schedule H1 created for second and third generation antibiotics. ICMR also published a general treatment guidelines for the common infections to prevent the unnecessary antibiotic use. So by law, the antibiotics are prescription only sale in India, but in reality, it's not true. Despite having these laws, hundreds and thousands of pharmacies are selling antibiotics without prescription and not at all maintaining a proper record for this. Indians are buying antibiotics without prescription. A survey in 2025 says that more than 20% of the Indian children are taking antibiotics by self-medication. A survey in Mumbai in 2023 says that only 43% of the people are taking antibiotics after consulting with a doctor. More than 53% of the people are sharing their antibiotics with the people who have similar symptoms. Over half of the people are stopping the treatment once they feel better. In rural and urban areas, due to the cost effectiveness and the convenience, people are buying the antibiotics directly from the pharmacies. Let's move on to preventive section. There are 3 ways to protect you and your family members from the antimicrobial resistance. Number 1. Antibiotics are lifesavers, but they are not magic candy. Whenever your doctor prescribes an antibiotic, you should ask 2 questions to your doctor. Number 1. What are the side effects and risks of taking antibiotics? If they happen, what you have to do? Don't be shy. Knowing the risks will help you better. The second method is hand washing. Hand washing is a simple method but huge power. Hand washing is a primary defense mechanism to prevent yourself from germs. Wash your hands before eat or handle a food, before and after taking care of the patient or loved one, and after coughing, sneezing and using a toilet. Number 2. Danger of misuse. You should not save antibiotic for future use. And then you should complete the course of antibiotic which is prescribed by your doctor completely, even you feel better in between. Why it is so? Because if you does not kill all the bad bacteria, the strongest one will survive and multiply and produce strains of bacteria which will have resistance towards the antibiotics. That will lead to antibiotic resistance. That's what we are talking about. Third weapon is vaccinations. Vaccinations aren't just for kids. They are powerful tool to prevent ourselves from the serious illness like flu or COVID-19. So while vaccinating, you are doing 2 good things. 1, you are protecting yourself from the infection. Number 2, you are protecting your community like small babies and the elderly one who cannot be able to be vaccinated from infected with germs. And then vaccination is nothing but a session. It's a training session for our immune system. Last but not least, we should not buy antibiotics without prescription. Even though the laws are not properly implemented, even though the pharmacies are selling antibiotics without prescription, we should be a little bit conscious about the decisions we are making in our life. Go and consult a doctor. He will tell you whether you need antibiotic or not. As an Ayurvedic doctor, I will tell you what are the measures you have to take during cold and cough. Number 1. Take lighter meal, which is easily digested by your gut. Example, green gram soup, vegetable soup and porridge. Number 2. Do salt water gargle 3 times a day. Number 3. Take Tulasi Swarasa 30 ml in the empty stomach in morning, followed by taking warm water. Number 4. Throughout the cold and cough, Take warm water which is infused with the ginger or else the cumin seeds. Number 5. Give a complete rest to your body. If you don't feel better even after doing this, go and consult your doctor. Thank you. Nandri. Vanakkam.